Assalamu alaikum everybody. This presentation is continuation of our talk about drug treatment of mood disorder. Today, inshallah, we will talk about very important group of antidepressants which are the selective serotonin reuptake inhibitors. Why this group is important? It is because this group has low side effect profile and contraindications when compared to the old antidepressants we talked about, like tricyclic antidepressant and the monoamine oxidase inhibitors. Selective serotonin reuptake inhibitors nowadays became a blockbusters for the pharmaceutical industry. So join me in the discovery of this group of drugs. So the main goal of this presentation is to know the pharmacological profile of selective serotonin reuptake inhibitors. This will include their kinetics and the importance of their kinetics, their dynamics, including their actions, what actions they are producing, and what are the mechanisms involved in these actions. And lastly, we will end up with their clinical application. So, what are these groups we are studying? As we have described before, that most of the antidepressants they act through the monoaminergic system by increasing the availability of the monoamine at the synapse. So in this case, as we can see in the figure, once the monoamine is released, it will into the synapse, into the synaptic cleft. Once it is released, they will act on both synaptic receptors and as well on presynaptic receptors. After they produce their action, as we have described before several times, they will be inactivated by the process of reuptake. The monoamines, after they bind to their own receptors, either postsynaptic or presynaptic, they will be reuptaken back into the adrenergic nerve terminal, and inside the nerve terminal, they will be either metabolized by monoamine oxidase, as we explained before, or they will be stored again into the storage vesicles. Okay? So if we inhibit the reuptake and an inactivation is stopped, that means the availability of the monoamines in the synapse will be more, and this will increase the aminergic activity, and they have said that this will result in antidepressant effect. Okay? So the reuptake inhibitors, the first group, the reuptake inhibitors, they are a group of drugs which either inhibit selectively the serotonin reuptake, and they are known as selective serotonin reuptake inhibitors or SSRIs. Well, this group of drugs are the most important group of drugs discovered in the late 20th century. They are proved to be very effective in treatment of depression with less side effect and contraindication when compared with the old generation antidepressants. Second are groups which inhibit both serotonin, which is the 5-hydroxytryptamine, and as well they inhibit norepinephrine or noradrenaline. They are known as serotonin norepinephrine reuptake inhibitors. So first group will be serotonin reuptake inhibitors, with second are the serotonin noradrenaline reuptake inhibitors, which are known as SSRIs. These are very famous group. Why? They are very effective in treatment of depression. They are commonly used. تقريبا many millions of people have used this drug in one time of their life. So what are the examples? The first to be introduced in the late 1980s was fluoxetine and Prozac, very famous Prozac. It is used widely all over the world. Fluoxetine turned to be a blockbuster. It brought billions of dollars to the Eli pharmaceutical company who discovered the drug. Then paroxetine was introduced, which is similar in its pharmacological profile to fluoxetine, as you will see. Paroxetine. The third example is citalopram. The fourth is acetalopram. escitalopram. The fifth is fluvoxamine. Well, last example, the most famous, the famous sertraline, okay? Yet these drugs, these are examples of the selective serotonin reuptake inhibitors. So what is the pharmacological profile of this group of drugs? As usual, pharmacological profile, we are talking about the kinetic property and the dynamic property. Pharmacokinetic, as we have described before, how the body behaves with these drugs, and the pharmacodynamic property, how these drugs behaves within the body. So first is the pharmacokinetic property. These drugs, they are known to be metabolized by the cytochrome. Most of them, they are metabolized by the cytochrome B450 enzyme, which is in the liver, of course. So what does it mean, metabolism by cytochrome B450 enzyme in the liver? That means if they are taken with another drugs that will stimulate cytochrome B450 enzyme, that means their metabolism will be increased metabolism of selective serotonin reuptake inhibitors. Of course, then if this enzyme is increased, their rate of metabolism will increase, and their level in the body will decrease, their level in the body, and vice versa. If the other drug taken with the selective serotonin reuptake inhibitors inhibit cytochrome B450 enzyme, like cimetidine and other groups, in this case, what will happen? I will inhibit metabolism of selective serotonin uptake inhibitors. If we inhibit the metabolism, I will increase levels in the body. They will be increased in the body, okay? So this is important. They are mostly metabolized in the liver by the cytochrome B450 enzyme, okay? The other fact, if they are metabolized by this liver enzyme, that in case of liver dysfunction of any reason, liver dysfunction, in this case what will happen? Their metabolism will be increased. And old people or people with defect in the liver function, usually they receive less dose of these drugs. Why? Then their metabolism depends completely on the liver enzyme. Okay? The other point we have to consider in their kinetic, in that some of them, they are metabolized to active metabolite. When we say they are metabolized to active metabolite, this case they are known as prodrug. وأشهر مثال is fluoxetine. Fluoxetine is example of selective serotonin reuptake inhibitor, which acts as a prodrug metabolized to another active metabolite. Of course, this means that it will have a longer pharmacological duration of action. So in kinetics of this group of drugs, they are similar. They are metabolized in the liver by the cytochrome B450 enzyme. Some of them, they are metabolized to active metabolite. We have to consider the kinetic in cases of drug-drug interaction, and as well we have to consider the kinetics in cases of old people or liver diseases. The second is the pharmacodynamic property. Well, pharmacodynamics, as we have said several times before, we are talking about actions and their mechanisms. We have said before in pharmacodynamics, pharmacodynamics deals with actions of drugs and how these actions are produced, which are the mechanisms. And we have said these actions, some of them, they are desirable action. And if they are desirable، معناها desirable بالعربي مرغوب فيه، يعني تأثير مرغوب فيه. زي في الحالة هذه شو نبي؟ يعني نبي مضاد للاكتئاب، تأثير مضاد للاكتئاب، هذه نسموها desirable action. The desirable action usually it is a therapeutic use or indication. Okay. The other actions, they are known as side effects, which we don't undesirable actions. Some undesirable action, they are known as side effects and other actions. These side effects sometimes they are contraindication. يعني معناها in this case the drug should not be used under certain conditions, as we will see. So this is what we are going to talk about. We are going to talk about actions, and we will identify whether the action is a therapeutic action, in this case it is an indication, or it is a side effect or contraindication. So the first action of these drugs, which is common, very common, it is known they produce nausea and vomiting. They produce nausea and vomiting. With nausea and vomiting, of course, there are undesirable side effects. So usually there are side effects. They are undesirable action and they are considered to be side effects. And mechanisms responsible for the nausea and vomiting is a direct effect of these drugs on the gut, on the smooth muscles of the gastrointestinal tract. Direct effect. This direct effect will increase intestinal motility, or therefore increasing the intestinal motility if stomach will cause nausea and vomiting. Okay, and this will result in nausea and vomiting. Usually, how we can avoid the nausea and vomiting? We can avoid the nausea and vomiting in the start of the treatment. We increase the dose slowly. Increase the dose slowly. We don't give the highest therapeutic dose at the beginning. We give the dose slowly to avoid the nausea and vomiting effect. وكذلك this nausea and vomiting usually disappears after a certain period of therapy. يعني after 3 to 4 weeks of therapy, usually this nausea and vomiting disappears. Okay? يبدأ this is the first common side effect. They can produce nausea and vomiting due to central and peripheral effect of these drugs. The second common side effects, they produce sexual dysfunction. Sexual dysfunction of all sexual function. They are known to decrease libido. Libido means sexual desire. The sexual desire will be decreased. The person sexual desire will be decreased. Okay, which is not favored by many people. Also, they will affect will decrease erection في المale. They decrease erection in male. معناها in this case in male or in male the achieving and maintaining erection will be defected. Also the sexual dysfunction, they inhibit ejaculation. They delay ejaculation. ما دام delay ejaculation معناها they will delay orgasm. They will delay orgasm. Okay. Also in female they produce vaginal dryness. In female they produce vaginal dryness, which is usually results in reduced lubrication during sexual intercourse. Of course, it is uncomfortable بالنسبة for the lady during the sexual intercourse. These are the common side effects of sexual dysfunction of selective serotonin reuptake inhibitors, and this will limit the clinical application in certain number of patients, and it will not like the undesirable sexual dysfunction. Okay. The third common side effect is the headache. Headache as usually it is common in most of the people, and it is usually decreased by increasing the dose slowly. But these three common side effects we have described, nausea and vomiting, with sexual dysfunction, with headache, they are common side effects. Yani they appear in many of the patients treated with selective serotonin reuptake inhibitors. There are other uncommon side effects which are usually rare side effects. They are not common. They usually relatively uncommon, or they are rare, or they happen in certain persons, yani not in every patient treated with these drugs. These are the movement disorders. Well, movement disorders involves many different types of movement disorders. يعني في اختلال في الحركة. اختلال شنو؟ في الحركة. الأول حاجة, first movement disorder which was described in some patients زي ما قلنا because it is a rare side effect is the akathisia. Well, akathisia is irreversible desire to move. يعني ال person will feel irresistible desire to move. يعني he is in constant motion. He wants to move all the time. Okay? They said that this akathisia, which is an irresistible desire to move, irresistible desire for movement. And a person is in constant motion. He is moving all the time. He cannot stay still. Okay? Irresistible desire for movement. And a patient in his constant motion. This is, they said, due to high dopaminergic activity. And it is not related to 5-hydroxytryptamine or noradrenaline. It is due to higher dopaminergic activity induced by these drugs. They inhibit the uptake of dopamine at the nerve ending, especially from nigrostriatal pathway, and this will result in akathisia. And akathisia, as we have discussed before, nigrostriatal pathway is the pathway which is part of the extrapyramidal tract, and it is responsible for the fine movement. Yeah, but this is the first, akathisia. Akathisia, as we said, it happens, ولكن very rare. ولكن we should consider that because we are learning clinical application of these drugs, so we have to be aware of even the rare side effect. ثاني side effect, second side effect اللي هو related to movement disorder is the tardive dyskinesia. Tardive dyskinesia. ولا dyskinesia. Tardive dyskinesia. Tardive dyskinesia. Tardive dyskinesia, as we have explained before, it is involuntary repetitive movement. Involuntary repetitive movement. Repetitive movement. Involuntary يعني movement. Especially in the face and the tongue. Takes place in the muscles of the face and muscles of the tongue. فمعنى مثلا لو صارت في المسلز of the tongue يحصل tongue protrusion or whatever, ولا lip smacking or whatever. This is usually associated with strong potent antipsychotics, as we have explained before when we talked about the antipsychotics which block dopamine receptors. We have said that after blocking the dopamine receptors for a long period of time, this will result in hypersensitivity of dopamine receptors, and this will end up with tardive dyskinesia. If the tardive dyskinesia is most common side effects with antipsychotics, but they have been seen with the people treated with selective serotonin reuptake inhibitor. Is it common or rare? No, it is rare side effect. It is repetitive, involuntary movement of the face, the tongue, and mouth. Okay? Third movement side effect, which is known as dystonia. dystonia وجاي من اسمها dystonia معناها في sustained muscle contraction. Sustained muscle contraction which will result in movement, twisting movement. يعني the posture of the body will be abnormal. Okay? يبدأ dystonia جاي من يعني خلل في tone of the muscle. Tone of the muscle will be disturbed. tone of the muscle is responsible for posture, as we have said. الوضع بتاع الجسم في erect position ولا whatever ولا depends on the tone. If يحصل disturbance in the tone of the muscle, this results in dystonia. Dystonia شو معناها? What does it mean? Means sustained muscle contraction. Sustained skeletal muscle, of course. Skeletal muscle contraction. Sustained skeletal muscle contraction will result in defect in posture. Posture defect يعني وضع الجسم in the space will be defected or posture defect. Okay? يبدأ abnormal posture or posture defect is dystonia happens. Is it common or rare? It is rare ولكن it happens. يعني we are as a medical profession we should know, we should be aware that the person treated with selective serotonin, because they are commonly used, they are used very common, so we have to know that they can produce dystonia in some patient, although it is rare. الفورت will last movement disorder, they can produce Parkinsonism. اللي نسموه بالعربي المرض الرعاش. مرض الرعاش الباركنسونيزم اللي هي التريمر والريجيديتي اوف ذا سكيلتال ماسل. باركنسونيزم معروفه يحصل في تريمر رعشه وريجيديتي. سكيلتال ماسل العضله المخططه سكيلتال ماسل شنو يحصل فيها؟ يحصل فيها رعشه اللي هو التريمر ويحصل فيها تصلب ريجيديتي. معناها البيرسون ويل موف ايزيلي ولا difficult in movement. معناها بيحصل difficult in movement. هذه يسموها will lead to what's known as bradykinesia. bradykinesia difficulty in movement. Okay. يبدأ selective serotonin reuptake inhibitors can produce rare movement disorder especially in high doses which will result in 4 different movement disorder including akathisia, which is the inner restlessness or irresistible desire to move. The patient will stay in a constant motion. He cannot sit on a chair. He is always moving around. A second side effect is tardive dyskinesia. Tardive dyskinesia, as we have said, is involuntary repetitive movement in the muscles of the face or the mouth or the tongue, which will result with certain side effects like lip smacking, like tongue protrusion, etc. The third is the dystonia, which is due to sustained muscle contraction, the trunk of the body, which will result in a twisting movement or abnormal posture. Lastly, Parkinsonism, which will result in tremor, and rigidity with difficulty in movement, especially with old people suffering from Parkinsonism. معناها supposing the patient is suffering from Parkinsonism, shall we prescribe for him selective serotonin reuptake inhibitors? No, we should avoid them. The patient is suffering from dystonia for any reason. Shall we prescribe selective serotonin reuptake inhibitors? No, because his dystonia will be increased. The possibility, of course, because they are rare side effects. Okay. The last rare side effect is the serotonin syndrome. And serotonin syndrome we have described last time. Serotonin syndrome we have described last time, last lecture. وقلنا it is life-threatening. It can lead to death. It can lead to death if not treated. Why? لأن البيشنت he will enter into 2 different types of symptoms. Central symptoms which involve central nervous system including confusion, hallucination, agitation, and agitation, and the person his control on his mental activity will be disturbed. وكذلك peripheral effects on the body including the autonomic responses, increasing the heart rate, increasing the blood pressure, وممكن البيشنت يخش في arrhythmia with mydriasis and fever. والبيشنت ممكن يخش في chronic convulsion and death. Usually the serotonin syndrome, it is very dangerous. It is rare, but it can take place because especially with high doses of selective serotonin reuptake inhibitors or toxic dose. If the person takes, instead of 1 dose, he takes 10 or 15 times the dose, he can enter into serotonin syndrome. Serotonin syndrome, how we know that the patient is in serotonin syndrome? He will be confused, hallucination, and agitation, plus severe tachycardia, plus severe increase in blood pressure and fever. Of course, treatment of serotonin syndrome, as we have explained before, it should take place in the intensive care unit. Lastly, these drugs, not all of them, ولكن especially with citalopram and acetalopram in high doses. High doses of citalopram or escitalopram, they can produce QT prolongation. QT prolongation is the time for the contraction and the relaxation of the ventricle. If they are prolonged, معناها this will lead to what's known as arrhythmia, خلل في النظم, arrhythmia, especially the most dangerous, which is known as torsades de Pointes. So torsades de Pointes. This is very dangerous type of arrhythmia, which can lead to, of course, dizziness, or maybe they can produce loss of consciousness and death. Why? Because this arrhythmia will decrease the cardiac output to the point that the patient the brain will not receive enough blood supply, the patient will feel dizziness, and it can produce as well cardiac death. Cardiac death. Okay. We have explained the prolongation of the QT interval before with the monoamine oxidase inhibitors and with the tricyclic antidepressant. You have the selective serotonin reuptake inhibitors, especially the citalopram with acetalopram. In high doses, they can produce QT prolongation, or QT prolongation will result in arrhythmia, arrhythmia will result in a certain type of arrhythmia known as torsades de Boyne, which torsades de Boyne can lead to cardiac death. Okay. The last dynamic action we are going to discuss is known as FDA black box. FDA black box. What is the FDA black box? The FDA in United States, they found in these drugs in some patients, not in all, it is rare. It is rare. ولكن it happens in these drugs they increase suicidal thoughts. الأفكار انتحارية. الأفكار انتحارية للpatient will be increased. They will increase suicidal thoughts. الأفكار الانتحارية للpatient will be increased. يعني he might commit suicide. Usually this takes place in people less than 25 years old. يعني young adults less than 25 years old. Okay. فلقوا ان high percentage of patients less than 25 years old they suffer from increase in suicidal thoughts. Therefore, FDA they have said that these should be stated on the leaflets, drug leaflets, that these drugs they can increase suicidal thoughts in patients less than 25 years old. وسموها ال FDA black box. Okay. Yeah, in this case, what we should do if the patient is young, we should find an alternative. يعني not to use the selective serotonin reuptake inhibitors. We use other drugs for younger patient. وفي الحالة هذه as well, we have to inform the patient and his family. We tell them the potential risk of suicide. Okay. ونقول لهم these drugs they might increase the suicidal tendency. Okay. وكذلك we have to put the patient under very close medical supervision. Okay. The FDA have recommended that when we use selective serotonin reuptake inhibitors in young patients, that if there is no alternative, we should inform the patient that he might suffer from suicidal thoughts, and we should as well monitor the patient closely to make sure that he is not suffering from these side effects. Of course, as I have said, these 3 or 4 side effects, including movement disorder, serotonin syndrome, QT prolongation, and the FDA black box, they're all rare side effects, ولكن we have to take care of them. Okay. This is the first group. So what are the clinical applications of this group? What are the clinical application of the selective serotonin reuptake inhibitors? They have a psychiatric use and they have a non-psychiatric use. يعني psychiatric use in the treatment of mood disorder وكذلك in the treatment of anxiety or neurosis. Okay. يعني they have first psychiatric use في علاج الأمراض النفسية. صح؟ Major depressive disorder, and we have explained before what does it mean a depressive disorder. Usually we start with the low dose and we increase the dose slowly till we reach the maximum dose. Why we should start with the low dose? To avoid the side effects that we have described. Usually it takes from 4 to 6 weeks for the actions, the therapeutic effect to appear. It takes 4 to 6 weeks. Okay. Of course, the response is relative. It depends on the person's response. Some people, they respond very well to the selective serotonin reuptake inhibitors, and some people, they don't respond to the selective serotonin reuptake inhibitors. Okay. Now, they say that prescribing selective serotonin reuptake inhibitors with mirtazapine which is a typical antidepressant, usually results in using less doses of both, معناها less side effect of both, and we get a higher efficacy. Higher efficacy معناها higher therapeutic response. Okay? Yep, this is the first major use. They are recommended for the treatment of major depressive disorder, and in this case, طبعا all this should be done under very close medical supervision or from a psychiatric specialist, not anyone. Okay? Yep, this is the first use. The second use, they are used in treatment of certain types of neurosis, neurotic illnesses. We have said before that the neuroses contain many mental illnesses. For example, they are used for treatment of anxiety. Anxiety is one very famous neurotic illness, neurosis. If we are talking about the use of selective serotonin reuptake inhibitors in treatment of neurosis. أول حاجة في anxiety disorder. And we have explained before that anxiety اللي هو continuous feeling of worry and agitation, usually there are many types, including generalized anxiety or GAD, generalized anxiety disorder, وكذلك social anxiety disorder. The generalized anxiety disorder, that means يحصل anxiety symptoms اللي هو الworry and agitation والfear continuously, يعني there is no underlying cause. While the social anxiety disorder usually is due to exposure to social events, social اجتماعي. يعني when the person is exposed to a social events، زي حالة البرفورمانس، واحد بيعطي محاضرة مثلا، فلما قبل ما يعطي محاضرة he will feel fear و severe anxiety و severe worry. This is known as social anxiety disorder. ولا في الميتينجز لما some people when he meets a new person usually he feels social sad اللي هو social anxiety disorder. Okay, meeting new people or whatever, social gathering or whatever. Okay, يبدأ selective serotonin reuptake inhibitors are very effective in treatment of anxiety disorders. What's the difference between them and the benzodiazepines we have described before for the treatment of anxiety? In the benzodiazepines, they are drugs of dependence. They can produce high dependence severity. And if we stop the drug, the person will suffer from severe withdrawal syndrome, as we have described before when we talked about the benzodiazepines. ولكن selective serotonin reuptake inhibitors usually they are withdrawal symptoms. withdrawal يعني لما نوقف الدرج، مثلا اعطيت الدرج لمده شهرين ولا ثلاثه وبعدين قررت نوقف الدرج. لما نوقف الدرج withdrawal symptoms usually they are mild. They are not severe as in cases of benzodiazepines that we talked about before several times. Okay, not like benzodiazepines, they can produce life-threatening withdrawal syndrome. Okay, this is the first in treatment of neurosis, in treatment of anxiety, Second use is their use in panic disorder. They found that selective serotonin reuptake inhibitors, they decrease the frequency and severity of the panic attack. Usually this requires treatment for several weeks. Third, neurotic illness for which selective serotonin reuptake inhibitors are used for treatment of obsessive compulsive disorder. وشرحناها before. What does it mean, obsessive compulsive disorder? Last, they are used for the treatment of post-traumatic stress syndrome. We have explained before what are these. Post-traumatic stress disorder. Okay, these are the psychiatric uses of the selective serotonin reuptake inhibitors. The second important clinical application of selective serotonin reuptake inhibitors is their non-psychiatric uses. These include several illnesses. The first is the menopausal vasomotor symptoms, which is usually takes place after menopause in women, where it expresses itself as hot flashes, night sweats during menopause. So in this case, usually selective serotonin reuptake inhibitors, they will reduce the frequency and severity menopausal vasomotor symptoms. The other application is the treatment of premenstrual syndrome. Premenstrual syndrome. Well, premenstrual syndrome usually takes place before the menstruation of the lady during the luteal phase, and in this case, the lady will suffer from physical and emotional changes. The physical symptoms include headache, muscle pain, headache, very famous, muscle pain, very common, muscle pain, pain in the muscle, maybe breast tenderness, etc. Yep, these are the physical syndrome which the lady will feel before her menstrual cycle. There is also emotional changes where there is a mood swings, changes in the mood of the lady between depression and anxiety, irritability and fatigue. يبدأ فيه تقلب في المزاج. Mood swings معناها تقلب في المزاج. Sometimes she feels depressed, sometimes she feels anxiety, sometimes she is irritable, feeling fatigue. يبدأ this usually takes place before the menstrual cycle قبل العادة الشهرية. That's why it's known as premenstrual syndrome. Premenstrual syndrome. في الحالة هذه selective serotonin reuptake inhibitors will decrease the severity and frequency of this syndrome. When these syndromes are so severe that it will cause excessive emotional and physical symptoms, in this case it is known as premenstrual dysphoric disorder. Premenstrual dysphoric disorder. The premenstrual dysphoric disorder, it is form of the premenstrual syndrome, but it is a very severe form. Very severe form. Usually it is classified as a mental disorder. Classified as a mental disorder. In this case, selective serotonin reuptake inhibitors will reduce both physical and emotional syndrome. Third application of the selective serotonin reuptake inhibitors, they are used as an adjuvant with analgesics in treatment of certain types of chronic pain, like neuropathic pain, etc., like fibromyalgia, as we have described before several times. They are used as adjuvants with other analgesics in treatment of different types of pain, chronic pain, like neuropathic pain and fibromyalgia. Premature ejaculation. This is an off-label uses. It's not indicated by the FDA or any other health authority. Premature ejaculation. As we have said, the selective serotonin reuptake inhibitors, they produce this sexual dysfunction, including delay ejaculation. The selective serotonin reuptake inhibitors, they can delay ejaculation. That's why they are used off-label use. It's not indicated by the FDA or any other health authority. They are used to delay ejaculation in cases some male will suffer from premature ejaculation. Ejaculation immediately after a very short period of sexual activity. So some of them, they suggested to use selective serotonin reuptake, but this use is accompanied by the other sexual dysfunction, like the decrease in the sexual desire, like the decrease in the orgasm, etc. Okay? These are the non-psychiatric uses of selective serotonin reuptake inhibitor. The selective serotonin reuptake inhibitors, they have very important clinical uses in treatment of different psychiatric disorders like major depression, and as well in certain types of neuroses like generalized anxiety and social anxiety and certain types of phobia and certain types of manic disorders. Also, they have non-psychiatric uses in treatment of different symptoms in ladies, especially related to the menstrual cycle of the lady, and also they are used as an adjuvant with other analgesics in treatment of certain type of pain, and they have off-label use as in the treatment of premature ejaculation, although this use carries the risk of decreasing the sexual desire. So in summary, we can say that the selective serotonin reuptake inhibitors, they have many side effects. Some of them they are common, some of them they are rare. Common side effects includes nausea and vomiting, sexual dysfunction, and headache. Rare side effects includes movement disorders, QT prolongation, and fatal serotonin syndrome. They have many clinical uses, including psychiatric and non-psychiatric clinical application. We have said that they have very important clinical psychiatric application in treatment of major depressive disorder and many neurotic illnesses like GAD, generalized anxiety disorder, or social anxiety disorder, or panic attack. They have non-psychiatric uses including postmenopausal and premenstrual dysphoric disorders and menopausal vasomotor syndrome. At the end, I would like to thank you for your attention, and I end up this presentation with a verse from the Quran. وفي أنفسكم أفلا تبصرون صدق الله العظيم والسلام عليكم ورحمة الله وبركاته. شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.